Behind the doors of a thriving neuropsychiatry clinic, there is often an invisible wall. On one side, patients receive life-changing care. On the other, the administrative team is being buried by the weight of the specialty's requirements. Consider a practice offering neuropsychiatry, sleep medicine, and transcranial magnetic stimulation. One physician and a small staff managing 3 distinct high-intensity specialties. Even when the clinical work is performed at the highest level, the sheer volume of specialized documentation can quickly overwhelm the frontline team. This chart shows the scale of the resulting burnout. In 2025, 41.9% of physicians reported burnout symptoms, with administrative burden as the primary driver. Among psychiatrists in private practice, that rate currently sits at 25%. Specialized clinical care requires more than general administrative support. Failing to align the workload with the right staff leads to inevitable team exhaustion. Identifying the solution requires looking at the exact daily workflows that cause these operational breakdowns. TMS scheduling is a primary example. Because these patients often require daily sessions for 6 weeks, a single missed appointment can trigger a mandatory clinical reevaluation before treatment can safely resume. This diagram illustrates the bottleneck in prior authorizations. Specialty medication approvals take an average of 3 to 5 business days, and 30% of these prescriptions require at least one authorization. Without constant follow-up, these submissions sit idle while care is delayed. Insurance verifications add another layer of risk. Because coverage rules for psychiatric treatments change frequently, a verification gap often results in an unexpected billing crisis that damages patient trust. Meanwhile, the HIPAA-compliant messaging platform continues to fill up. Inquiries go unanswered, and reminders are delayed when the in-office team is occupied with the patients physically in the building. This visualization shows the eventual cost of that pressure. Front office turnover in healthcare has reached 40%, and replacing a single experienced staff member costs a practice up to $30,000. These structural failures create immediate risks to patient safety and the long-term stability of the practice. Recognizing these risks, the practice pivoted. They looked past general virtual assistants, who often lack the specific training for psychiatric environments, to find a more precise solution. They chose to integrate a dedicated, healthcare-trained virtual medical assistant through Staffingly. The transition was rapid. Within 48 to 72 hours, the VMA was onboarded directly into the clinic's existing electronic medical records and messaging platforms. To ensure accuracy, the VMA participated in weekly training sessions with the clinic's long-term billing staff, learning the specific logic of this practice's workflows rather than following a generic template. A dedicated model allows for institutional knowledge that a contractor pool cannot replicate. Within 30 days, the assistant knows your specific payer quirks. By 90 days, they operate as a fully integrated member of the clinical team. Remote support succeeds in specialized care when the worker is embedded and trained as a permanent extension of the medical staff. The results were immediate. TMS calendar gaps were flagged before they became clinical problems. Prior authorizations were tracked to approval, and daily insurance verifications were completed ahead of every visit. 2 months into the integration, the lead posted a public 5-star review. He highlighted that the remote staff met all professional and ethical standards, which allowed his in-office team to focus entirely on the patients in the room. Staffingly's administrative team provides active, continuous supervision to ensure these clinical care requirements are met consistently over the long term. This data shows the metrics behind the model. Clinics can achieve up to 70% in cost savings, with rates starting at $8 an hour. Staffingly currently supports a network of over 800 healthcare providers. Specialized back-end support restores the bandwidth of your in-office staff, letting them return their full attention to the person sitting in front of them. If your psychiatry or TMS practice is struggling with scheduling complexity or authorization backlogs, this operational model is ready for implementation. You can start with a 15-minute strategy call to map your current workflows and see exactly how a dedicated VMA fits into your team. Visit staffingly.com/demo to book a strategy session or call 800-489-5877. Resolving these administrative backlogs allows your clinical work to remain the central focus of your practice.